My name's Colleen Nestor. I want to welcome everyone here today for our 5th Behavioral Health Summit session. I'm a supervisor in the Bureau of Behavioral Health at the Howard County Health Department. I work with youth and family support services. I have a great team of folks here with me. We've been really pleased and proud to partner with Aetna and some other health department programs, including our local health improvement coalition, to bring you this wellness summit series that started back in November, actually. We are here now at our 5th event, and we have one more planned. We added one in because we had such great response. So we thank you all for being with us today. We're just going to go through a few housekeeping pieces here for you, and then I'm going to turn it over to our moderator and our panelists. I'm really excited about the group of energy we have coming together today. And I will share personally, I think just given the month of March and the transition we're currently experiencing with people returning to work in school settings and vaccines picking up in the community, here we are approaching spring, another transition. There's a lot of transition happening, and taking care of ourselves and growing our own wellness toolboxes, I think, is really important now more than ever. So how timely today's session is, given the events of our world right now. So Kirsten, if you wouldn't mind switching over to our housekeeping slide here, I'm going to review a few of those housekeeping details for everyone. So as Kirsten just noted, today's event is going to be recorded, and so this will be archived and live on our website for everyone to access and share after the event. Participants are muted upon entry, so that way we can allow for minimal disruption during the event. But we do welcome feedback and comments and participation. So I want to call your attention to that little chat bubble on your screen. The chat box is how we can receive feedback, comments, questions for our panelists. So we will use that throughout today's event to share information with you and hopefully receive information from you. So please use that chat feature during the discussion to share your thoughts and to ask questions. And as a reminder, we'll share some information about those recordings and events at the end so you can access. Switching into this check-in moment, we just ask that you take a minute to reflect kind of how you're coming to the space today. What are you bringing with you today? Where are you at with your emotions? We'll talk about some resources in just a minute, but just really reminding everyone that everyone kind of comes with certain things they bring with them, and we want to be respectful of that. And so we hope today's experience is a non-judgment, open mind zone, and people can use the chat respectfully and share opinions freely and respectfully. Just kind of think about what you're needing today and what you might hope to get out of today's event. That being said, it's a good time to remind you of the resources right now. The pandemic has really brought on a lot, and we know that feeling is processed differently for everybody. So just reminding you and family members and loved ones that you are around that there are lots of different ways to connect right now. So in addition to the Grassroots Crisis Hotline, which you can call 24 hours a day, 7 days a week, there is also the Maryland Crisis Connect Hotline, and there is a crisis text line. For those of you who don't want to speak but want to text, there's a text line. The behavioral health directory and resources through the health department, which we'll share with you, are also another way. So if you're feeling overwhelmed or need crisis, please reach out. Okay, today's goal. We are going to be talking about growing your wellness toolbox and how now more than ever, really, the mental and emotional health of our beings are just as important as our physical health, and prioritizing that. And how do we prioritize that? And what tools do we have at our disposal to do that? So we have a really varied group on our panel today that are going to share some great things with you. And so we're looking forward to that. We will follow up at the end with some closing remarks and some resources to share. So you'll see that in our flow today. And again, throughout, please use the chat to chime in as you need. And with that, I'm going to mute myself here and turn it over to my colleague, Kelly Klessler, who is our Director of the Bureau of Population Health.
Thank you, Colleen. Thank you so much, everybody, for joining us today. I'll be really quick. Again, my name is Kelly Kessler. I am not only Director of the Bureau of Population Health, but have had the opportunity to work within our community for the last 4 years as the Director of our local health improvement coalition. And I'm really thankful for the opportunity to, collaborate, continued collaboration. It's actually interesting. We're marking a whole year of some really intentional collaboration within the health department, both the Bureau of Population Health and LHIC, as well as with our partners in the Bureau of Behavioral Health. And we're so excited that it has really expanded into this additional partnership with collaborators like Aetna and other organizations to really think about how we're bringing education and information and engaging with our communities differently. So it's really lovely. I'm looking at the participant list, seeing names of many of our coalition members as well as community members that I just recognized from being part of the community. And so we're very excited to have you all here today. And really, again, thank you so much for the continued partnership with Aetna and within our Bureau. Colleen, I'll turn it back over to you.
Great. I'm going to now kick it over to Marcus Duckworth, who's going to say a welcome on behalf of Aetna. Marcus?
So good afternoon, everyone. I'm Marcus Duckworth, Vice President of Client Management for our dedicated public sector team. And as a health company, we certainly understand the importance of health and well-being, especially when it comes to self-care and mindfulness. So we're very excited to support and be a part of today's discussion. And we'd also like to thank Howard County and the Health Department for this continued partnership and discussion of these very important topics to support the broader community. With that said, I'd like to now introduce the moderator for today's panel, Lisa Morrill, Supervisor, Recovery Support and Harm Reduction Program, Howard County Health Department.
Thank you very much, Marcus. Good afternoon, everyone. Great to be here today. We are very fortunate to be joined by three very accomplished panelists this afternoon. So without further ado, I'd like to introduce them to you. They will be up on the screen, as you can see. The first is Ms. Stephanie Jacko. Stephanie is a briefing manager, holistic wellness coach, and mindfulness advocate on Aetna's community affairs team. She is a dedicated wife, mom, and natural optimist. She teaches yoga and mindfulness as tools that individuals can access whenever and wherever they are in their wellness journey. In early adulthood, it was actually trauma that brought Stephanie to the mat, and that's where she first learned how healing and transformative a yoga and meditation practice could be. So she built on this knowledge, training as a yoga and meditation instructor, and earns her 500-hour Alliance Masters of Yoga Therapy designation. She is a certified wellness coach, and she's developed her own unique yoga and mindfulness classes that combine asana, which is movement, prana, which is breath, as well as life lessons. And this blend of practice has helped her students bring awareness to their healthiest self, both on and off the mat. Next, we have Mr. Adam Bloom. Adam currently serves as the clinical director of Colmac Outpatient Recovery Center's Columbia location. He is a licensed professional counselor in Maryland, DC, and Virginia, and he's been practicing as a mental health provider for the past 7 years. Over the past 7 years. Adam's clinical interests include working with patients with problematic substance use, co-occurring disorders, and trauma. He has extensive experience in providing clinical treatment and managing clinical programs throughout the metro area. He believes in a holistic, integrated approach to treatment and focusing on the mind-body systems connection. He's excited to be overseeing operations and treatment at Columbia Colmac, and he's proud to be following in Colmac's legacy of providing very high-quality, patient-centered care to people struggling with problematic substance use going back to 1973. So it's quite a legacy. Thank you, Adam. And last but not least, we have Dr. Sharon Jennings Rojas. Dr. Sharon, as she likes to be called, is the department chair of the Acupuncture and Herbal Medicine Department at Maryland University of Integrative Health. Her 30-year career in the field includes a strong emphasis in community outreach, healthcare advocacy, and healthcare access. Since 2001, she has maintained a private practice providing compassionate care to individuals, families, as well as communities. And as an extension of her practice, she served as an acupuncturist for the Howard County Health Department from 2005 until 2012. Dr. Sharon has served as the resident doctor of acupuncture and herbal medicine for the Howard County Detention Center for the last 9 years. There, she delivers acupuncture as well as other wellness sessions for residents, staff, as well as the administration. So thank you all for joining us It looks to be a very exciting panel. As Colleen mentioned, we are here to have a community conversation about prioritizing our mental and emotional health, self-care, and just generally growing a wellness toolbox. And I will say this is a topic that's near and dear to my heart. In addition to my work in the health department as the harm reduction supervisor, I also work on the side as a certified health coach after obtaining my certification in 2007 from the Institute for Integrative Medicine. So very honored to be the moderator for this great panel here today. So without further ado, let's jump in. The first question, we would like to open it up and hear from each of the panelists. But to get us started today, the question is, what does wellness mean to you? And can each of you share a little about your journey that brought you to work in this team, in this field, I'm sorry.
I guess I'll get started. Hi, my name's Adam. It's great to be here today. So wellness is a pretty broad term for thinking about different spheres of my life and the life of my patients. So when I think about wellness, I'm thinking on a broad spectrum of areas, including physical wellness, mental wellness, emotional wellness, as well as nutritional wellness, interpersonal wellness, occupational wellness, spiritual wellness, just to name a few. But I'm looking at how those systems interact into supporting someone holistically and trying to help them meet the goals that they are looking to meet. In my own work, I've with patients and in doing my own work, the mind-body connection is something that really interests me, and I find that sometimes when patients get stuck, or when I've got stuck in an emotional processing or psychological processing, that going into the body is really helpful for me, and to really kind of get that data that's coming from the physical parts of myself, in trying to utilize those sensations and that and the body to get unstuck in where my emotional world is. So since I found that to be helpful, it's something that I incorporated in my practice, and it's been really kind of opened my eyes in terms of holistic and inclusive wellness.
Thank you for that, Adam. And I know it came up last month in the summit meeting on youth that trauma, for instance, often gets stuck in the body. So very much appreciate you mentioning that to people in the audience who may not be as familiar with that concept. So I'd like to hear from Dr. Sharon as well as Stephanie.
Sure. Good afternoon, everyone. Thank you for having me. So, what Adam just mentioned is like true to life, right? So one of the things I always talk to patients about, or the community about, is a wellness wheel. And if you think about a wheel having a hub in the center and spokes, the spokes really represent various aspects of wellness, whether it may be interpersonal wellness, just like Adam was mentioning, financial wellness, religious or spiritual affiliation wellness, all of these things, in addition to body, mind, and soul. If the hub is intact of that wheel, then the wheel can roll along and make progress. And that's what we want to always focus on in the community and as individuals, is the ability to move through any type of challenge or difficulty despite what life throws you. The fact that the wheel can continue to turn means that the spokes are all intact. If we're wobbly, that means we need to address one of the wellness spokes. So wellness really is a composite of various things. It's kind of like when people say, I want to lose weight or I want to stop smoking. It doesn't just take one thing. It takes several dynamics moving at one time, right? It's not just cutting back on calories. It's also drinking water. It's not just drinking water. It's also taking a walk for 15 minutes a day. So all of these things really represent a composite of different behaviors that really help us to be better and well, body, mind, and spirit.
Hi, everyone. So I have to say, Adam and Dr. Sharon, your answers were so very eloquent and captured everything that I was also thinking of regarding this integrated model of wellness. As you said, Dr. Sharon, that it really is this corresponding relationship between mind, body, and spirit, and it's multifaceted within each component. For myself, I found mindfulness, as was mentioned in my bio, after trauma. And so I really learned from the ground up how to be able to see what these traumatic processes were in my psyche, in my emotional behaviors, and how it was stuck within myself. That really is what prompted me to begin to become a student of mindfulness and yoga and meditation as a tool to come back to this integrated model of health where I could find myself once again. So, in regards to how I approach health and wellness with my clients, it's really about looking at root causes for what may be going on in people's individual lives, and then seeing if we can unpack layers, dig deeper, and as with anything, realizing that personal struggles are often where we find our grit and connect into the grace, and find who we are at the end of the day. So thank you, Lisa.
Thank you all. And I love that, the grit connecting to the grace. That's beautiful. Thank you, Stephanie. Okay, so moving on, the next question, we'd like to start with Adam's response and then open it up to the other two. The question is, let's talk about the terms integrative health and holistic approaches to wellness. They can get kind of foggy for the average consumer out there if you don't know a lot about this field. So what do these terms mean and how do they relate to mental and emotional health? Adam, do you want to start us off?
When I think about integrative health, I'm thinking, I think a lot of us think about medical and physical health along with emotional and psychological health as well. But there's so many other pieces that come into integrative health and awareness. Again, when we're talking about wellness, looking at all those pieces, I love the notion that Dr. Sharon brought up with the spoke. So looking at those other pieces of the spoke that are helping the wheel turn around and around. And so we're looking at those pieces in terms of what is working well and helping someone move towards an integrative sense of wellness and cohesion. And what are those pieces that a person may need to work on in order to improve their sense of wholeness, wellness, serenity, whatever that looks like for that person. And when we're kind of with holistic sense of wellness as well, we're looking at all those pieces that are impacting the person's ability. I will say that most times I'm working on the strength because every patient brings in strengths. Every human brings in strengths. So there might be areas where someone is really strong. Maybe they work out and they're pretty comfortable in their workout routine, but they're really having difficulty with interpersonal connection, or they're having difficulty, or they do really well with spiritual wellness, but they're having difficulty with processing their emotional feelings. So what I'm going to do is I'm going to utilize those strengths to kind of augment where we need to work on helping them with their wellness journey. And I'll just also say that I loved what Stephanie said about the connection comes from the imperfection. If we're perfect, or we put up that facade, that can be really off-putting. So I find that imperfection, that ability to accept being flawed, is really what helps connection and that spoke of interpersonal wellness.
Thank you for that. I really appreciate your response, Adam. Dr. Sharon and Stephanie, did you want to speak to this question regarding the terms?
Yeah, I'll definitely speak to that. And Adam, thank you for reminding us of that we are perfectly imperfect, right? And all of us, no one is immune to that. And that is where we find our gems, right? Because every obstacle or challenge presents an opportunity. You know, in terms of integrative or health or wellness, one of the things that I think about is the ability to interface with everything that is important to that particular person in their lives. and then expanding out into their healthcare network and integrating with all of the practitioners that have an impact on that person's health, body, mind, and soul. So what that looks like, if we could just picture a Venn diagram, is having all the things that are important to a particular person or community, and where do those things overlap? And are all the individual pieces healthy? Are they whole? And if not, what are the different things that we can do as a community, as healthcare practitioners, to make those more whole, make them more full, make them functional in a way that the person can see results? So that could look like me interfacing with a general practitioner and getting releases of information from my clients saying, is it okay for me to speak with your practitioner? Is it okay for me to speak with your chiropractor? Is it okay for me to speak with your massage therapist? Because ultimately what I want to do is work in the same vein collaboratively with other practitioners for the benefit of my clients or the community. In terms of wellness, wellness looks the same way, right? And holistic measures, holistic practices. What are we looking at that represents a full spectrum of this person's life or the community? And how do we get those things to work cohesively, integratively for a better result?
Dr. Sharon, I'm going to jump in here quickly. Thank you for that. There is a little bit of an echo between your mic, so I'm wondering if the laptop mic can be muted and we can just hear you through the audio of your phone. We can hear you clearly. It's just a bit of an echo feed.
So I am muted on my laptop.
Oh, okay.
I am.
So
I'm not quite sure.
I
can
then. We can hear you.
Headphone.
Yeah, no, we could hear you, just a bit of an echo. So I just wanted to mention that. Thank you. Sorry to interrupt the flow there.
No, that's okay.
Sounds good. Lisa, back to you.
Dr. Sharon, thank you for everything you shared. I can particularly relate in having seen how when one aspect of wellness gets out of balance, even if many of the other aspects are, ultimately, if unaddressed, it can end up affecting the entire system, person. So wonderful point. And I didn't want to get off of this second question before we checked in with Stephanie to see if you wanted to add anything.
Thanks, Lisa. Yeah, one of the things that comes to mind in terms of integrative wellness models is that none of us operate in a vacuum with our lives. So as has already been mentioned, everything is interconnected. So just as you would look at a stained glass window, each piece is a beautiful, multifaceted, colorful piece that adds to the whole picture of your life. Oftentimes, people will look at wellness and say, okay, I want to work specifically on this, and then sort of, oh, I'm not ready to look at the rest of the picture. And it simply doesn't work that way. I think it's our job as healthcare practitioners to very gently bring about this concept of this holistic wellness model as something that you have to look at the whole picture in order to really see it clearly. So that is how I approach things. Thank you.
Thank you so much. Absolutely. And actually, Stephanie, this next question would like to start out with your response. It's about mindfulness. It's mentioned frequently as a self-care tool. So how does it work and why is it so effective?
Great question, Lisa. It's interesting because being a meditation instructor for many years, and then mindfulness sort of came to the forefront and became a word that you just heard everywhere. And yet it's a practice that has been done for hundreds of years. And really what it's about in its simplest form is about being in the present moment with an attitude of openness and curiosity. And the wonderful thing about the topic of mindfulness as a tool is that you can truly have it with you wherever you are. So whether you are stuck in traffic and your stress level is starting to increase, Or if you are sitting and meditating and connecting in with your breath and noticing thoughts that are coming up, there's an ample opportunity to be able to really tune in. And what I like to tell people is this concept of mindfulness, to me, is really about meeting yourself where you are without expecting this perfection. Because as Adam and Dr. Sharon both stated, we are perfectly imperfect. And so it's learning to embrace all of this and move forward with everything.
Thank you so much. I want to open that question up to the others. Do you all have thoughts you want to share on mindfulness?
I'll just say, so I love everything that Stephanie just brought into this space. What I find with mindfulness, as has been spoken about, is that it increases curiosity and being able to be present in the moment. And when we are curious and present, it minimizes our likelihood for self-judgment and self-criticism. And so if we can be curious without judgment or suspend that judgment or just even track the judgment, like it can be really helpful in improving emotional well-being, how we interact with the world. The more that it's practiced, and this was a life lesson that took me a really long time. It was one of those simple ones that felt really profound. Is when we work on mindfulness, it can help with acceptance of whatever you're working on. And that acceptance is not synonymous with liking, right? So I can accept something that I do not like about myself, and I can be okay about that, and I can choose what I want to do next. But that mindfulness piece allows me to really think about what's going on presently in my world or in a particular moment, and allows me to be curious, and minimizing or suspending that judgment can be really helpful in kind of thinking about what to do next.
Thank you, Adam. Dr. Sharon, did you want to add anything?
It's just a small snippet. I mean, I think my colleagues, they've mentioned everything about mindfulness that I would have said. One of the things I think of is having an attitude of gratitude, right? That there are many different things that can occur in a moment that can send us in a spin, either going backwards or forwards. When we go backwards, we basically rely on things that we cannot change. When we go forward, we are imagining things that we have no control over. The real balance is being in the moment, just like Stephanie said. And, being in that moment would require us then to be centered, to really focus on our attitude of gratitude. And to also remember that what we're in control over right now is the present. It's almost like surrendering to the serenity prayer, right? Like I can't do anything about what has happened before. I have no control over what's going to happen in the future. But right now, I have the capacity to determine how serene I'm being. So if I have control over that, that really empowers us, right? And then we can help empower someone else moving forward as well.
Thank you so much. That's such a powerful concept. And actually, Dr. Sharon, we wanted to start the next question off with you. If you wouldn't mind providing a brief overview about the practice of acupuncture and acupressure. What is important for people to know about how it works? And what would you say to someone who's skeptical of it?
That's a great question. Thank you. So acupuncture and acupressure is a medicine that is a system of medical theories and philosophies based on self-empowerment. It is what I call the people's medicine, meaning that really we have the capacity to heal ourselves, be it physically, emotionally, or spiritually. Let's just talk about the emotional and spiritual aspect. We have a nervous system that has access and releases endorphins. If we're able to tap on or press on certain areas of our body, there is a visceral response that takes place. And when the endorphins are released, it puts us in a better position to be able to heal, to feel better in the moment, and then to access the wherewithal to reach out into our communities to any medical practitioners that we may need. But from an emotional and spiritual standpoint, emotions and our mental capacity will lead the body, and the body will also lead the emotions. and our spirit as well. So it's really important to utilize this medicine and form of self-empowerment to be able to recognize our own strength, our will, as Stephanie put it earlier, our grit, right? And that grit actually helps us to fight for our health and our wellness. A lot of people tend to be skeptical because of the pins that are used. There's something called EFT, which is tapping, right? Emotional freedom technique, where we can tap on the points if you have, for example, a needle aversion. Most of the people that come in to see me, interestingly enough, are needle phobic. And we'll be talking, and before you know it, a sentence is finished, and they're like, oh, you're done? Right? So it's really mind over matter. It's being able to open ourselves up to the things that even we're fearful about. But when we overcome them, we have victory and we feel even more empowered. So I would say to those who are skeptical, be open. If you want to start with just pressing the points or doing EFT and having a practitioner show you how to do that, the next step, you won't even realize that you've already surpassed the fear, that you've gotten past it, and that before you know it, then you're utilizing also the pins. And the pins are hair thin, so you can't even really feel them. Very effective either way.
Thank you so much. And I can personally attest to the fact that both the tapping and acupuncture are very powerful and very effective. So thank you for that great explanation. So now that we have talked about both mindfulness and acupuncture, wondering if you can speak to some of the science behind it, how and why these practices work, and how they can be complementary to more traditional Western models of medical care. So if we could start with Stephanie on that one and then move over to Sharon.
In regards to mindfulness and the science behind mindfulness, mindfulness actually works when you are regulating your breath to help you go into a state of relaxation. So if you think about what the brain does, the brain is there to keep us safe, right? But the issue being that as we have evolved, the brain cannot detect whether you are in a state of actual of an actual event that is going to put you in danger, or if you're just remembering that state and you are worked up into a more stress-induced state. What mindfulness allows you to do is to connect in with your breath, and it actually helps to work to rewire the neurological transmitters within the brain. And so what this allows you to do is go into a state of rest and digest rather than the fight or flight state that we are often in due to stress cycles in our lives. Mindfulness has a variety of different benefits, from the emotional standpoint of reducing our stress levels, actually increasing our immune support from a health perspective. And it's actually been utilized in clinical settings quite a bit through the mindfulness-based stress reduction model created by John Kabat-Zinn, MBSR. So there are incredible benefits of mindfulness from a scientific standpoint. And for me, one of the greatest that I've seen in my own life is the ability to press the pause button, the stop button. When I am going to just react, I can scale back and be in the moment and respond effectively. And as Dr. Sharon stated, regardless of what is going on in your life, you're able to maintain your serenity. And as Adam stated, it's not necessarily that you have to agree with everything that's happening. However, you can respond from your point of strength rather than react from a point of a fear base. Thanks, Lisa.
Thank you. Thank you. Very well said. And Dr. Sharon, wanted to give you a chance to weigh in as well, if you like. I know you just said a lot about acupuncture.
Yeah, I mean, I think Stephanie encapsulated it really, really well. I mean, one of the things that we know for sure is that the flight or fight position that we're often in can you all hear me? Okay, good. the fight or fight position that we can become accustomed to is promotes dis-ease, I'll say that, and disharmony. Whereas if we do a depend and befriend activity, which is more really in alignment about or with thinking about what we are going to do and being responsive versus being reactive, that we put ourselves in a position where our neurological system is more at bay, we're calmer, we can make more educated decisions, we can respond appropriately. I loved what Stephanie said about pressing the pause button. Sometimes we even have to press the rewind button, right? We might have already started reacting, and so we press pause, go rewind, and apologize or say, I'd like to take that back. This is what I really want to say, and really being mindful about how we're feeling in here so it translates to here and then translates in behavior. So neurologically, really the endorphins in terms of what I was speaking about before plays a huge role. And I'd really like to push, another colleague of mine said to me the other day, it's not fight or flight, it's depend and befriend, right? Depending on somebody and then being able to speak about some of the things that you're experiencing, and more than likely that person can also help you to respond in an appropriate way.
So I just want to jump in because everything that's been said has been really thought-provoking. So when we think about mindfulness, the other pieces I want to bring into play is that mindfulness increases cross-hemispheric neurological wiring. So it brings the right and the left hemisphere of the brain together in a way that is more integrated. And when both hemispheres of the brain are working, it usually means that we're in a more serene, calm, present moment. Our body also does a really good job of creating, I tell my patients struggling with substance use all the time that our bodies are the best pharmacists, right? Like our bodies have all the chemicals that we need to regulate if we can access. So when we utilize mindfulness and deep breathing and present moments, we're activating our own internal opioid system. So those feel good, those calm down, that system is being activated when we are utilizing mindfulness-based strategies as well as serotonin input. So it really allows this whole idea of responding versus reacting, right? I can respond to a situation when I am more rational and when my executive functioning of my brain is online. And what mindfulness does is, because with fight or flight, our brains flip, right? Like we don't have access to if this is the prefrontal cortex, we don't have access when we're not in a mindful place, when we're activated. What mindfulness does is allow me to either stay here where the prefrontal cortex is online, or if I start flipping, noticing that and being able to come back to center in a quicker fashion, which allows me to respond differently than when I am in a reactive space.
Thank you so much for pointing that out, Adam. And actually, the next question is directed to you, if you don't mind. We'd like to hear some of the strategies or tools that you use within your practice that are effective in addressing stress, especially in times of COVID.
Sure. So a lot of the things that I do in terms of trying to reduce stress, first of all, it's all about the relationship in my practice. So the first thing is to really empathize and understand where my client is coming from, trying to validate and normalize what they are feeling. Because I feel it's interesting when you're able to validate and normalize, you'll see what the body does, because I think there's such a fear of being the only one. And I joke that terminal uniqueness is a situation that a lot of us have, right? So you can't necessarily, that terminal uniqueness, if everyone's feeling terminally unique, then it's not unique, right? I try to install patients that we're all special, but like we're not alone, but sometimes our barriers to our wellness make us feel that way. So the first thing I wanted to do is make sure that I'm connecting with that patient and making sure that that relationship is a strong one. And then I utilize a lot of different breathing techniques in my practice. We can access our breath without a lot of other tools, although you can add in a lot of different things. So teaching diaphragmatic breathing is part of what I do. I try to help them notice what it looks like when they're breathing diaphragmatically and when they're breathing from a stress response place, and helping them kind of identify when they're not breathing in a way that is going to be conducive to mindfulness. I do a lot of progressive muscle relaxation with patients, helping them, relax their body, and starting at the feet and closing and flexing and then releasing until they're in a place that feels really relaxed to them. I also focus a lot on square breathing, which is you breathe in for a certain amount of time, hold for a certain amount of time, and then if you really want to work on deactivating or bringing them to a more peaceful space, it's always concentrating on the exhale as longer than the inhale. So those are some of the breathing techniques and some of the body techniques that I use. Gratitude, that whole attitude of gratitude is something that comes into my practice all the time. We know that we know that gratitude can actually rewire the brain, and our brains are evolutionarily predisposed to the negative because our ancestors needed to know what they didn't have in order to survive, and those who didn't know and then were able to find what they needed were able to pass on their genetic material. So like I tell them, like, our brains are doing exactly what our brains are supposed to be doing, but we have the power to think about things differently. So I talk a lot about gratitude. I do a lot of present moment work of like 5 things we see, 4 things we hear, 3 things we can smell, 2 things we can touch. Taste is difficult in a private practice situation, so then I utilize gratitude a lot for that one thing we are grateful for in this moment. So those are just a couple. I also encourage patients, like, have you gone outside today? Let's talk about the wins. Let's talk about the small wins that you've had. Have you gone outside today? Have you changed from your night, especially in COVID? Have you changed from your night clothes into your day clothes? Have you taken a shower for 48 hours? Are you hydrated? So like, and they're like, because they'll come into a space and they will be like, I've done nothing. I don't feel successful. And then we go through like the daily wins of a day. They're like, oh, I guess I did do that. Oh, I did do that. So trying to pull their attention to the things that are that they're doing. And that makes them kind of like a daily rock star. So those are some of the things I utilize in my practice, especially now during COVID. Like the small wins are super important.
Thank you so much. Those are some great, great tips. So we are going to close out with one final question and then go to the questions from the Q&A. And we'd like to hear from each of you and your different perspectives with this last question. If someone is interested in holistic approaches to wellness and self-care, how do they get started? Where can they go to get resources or find a provider?
I'll jump
Somebody
in.
like to start? Thanks.
Yeah, I'll jump in, sure. One of the things that I think you can always access is your Department of Health within whatever county that you're in. Of course, with Howard County Health Department, I can definitely attest to the fact that it is one-stop shopping there, and you're treated as a valuable part of the community. The other thing is to access your healthcare provider, for example, who could provide you with resources. Your insurance company as well can basically refer you to providers within your catchment area. And you can also, really be an educated consumer. Don't be afraid to walk into a provider's office and ask questions. You also want to pay attention to bedside manner because there are many technicians, but chosen healers. And so you really want to align yourself with a chosen healer that can really speak to and understand cultural competence, whatever the culture that you may be coming from, whether it be, religious or racial or whatever it is, sexual orientation. You want to make sure that all of those things are really honored and valued wherever you go. Be an educated consumer.
Great points. Stephanie, would you like to go?
Absolutely. So I second everything that Dr. Sharon mentioned. Also in regards to mindfulness and starting on your journey there, I highly recommend mindful.org as a website to get started. It'll help you find some foundational information about mindfulness and the different practices, as well as the science behind it. Of course, there are so many different apps out there that you can download on your phone. But my biggest place to get started on a mindfulness practice that I try to help people with is to simply see if you can bring in 5 minutes of sitting quietly by yourself and just noticing your breathing. Many times when people are looking to get started on a wellness journey, they get excited and they think, okay, well, I've got to do 40 minutes a day of meditation. And it's simply not the case. Luckily, studies have found that even 5 to 10 minutes of mindfulness a day can have incredible benefits on your life. So just finding what works for you in your day, whether it's in the morning and before you get out of bed, just noticing your breathing, jotting down a couple of things that you're grateful for, right even before your feet hit the floor, can help you get started with your mindfulness journey. And of course, I highly encourage anyone who's looking to try yoga to find additional resources online. And I could certainly, Kirsten, I'll send you some resources that way as well. But I also second the concept of making sure that you are connecting with a teacher and practitioner that speaks to your heart. Because just like, if you were to go get a haircut and you didn't like the haircut that you got, you would never say, well, I'm never getting a haircut again. You would go and you would find another beautician, right? The same practice should be applied for finding a teacher or a therapist that you really connect with. Once you have that connection, it can really help you. You should be able to sit with them, talk about your goals, and map out a wellness plan that specifically meets your needs.
Great points. Thank you so much. Dr. Sharon, anything you'd like to add?
I would just like to add the fact that, remember that your body, your mind, and your soul are wise. Listen to your intuition. Be in touch with your soul, your spirit. Pay attention to the aches and pains you have in your body, if you have any, because ultimately they are our teachers. They teach us what we need to do, whether it's to slow down or to speed up or to take a walk or to take a nap. So just remembering the power of you, each and every one of you, and your contributions to your community.
Fantastic. Well, thank you all for a very useful and inspiring conversation. And I'm going to turn this over to Colleen for the other questions.
Great, thanks everyone. So we're going to go, there were a few great questions in the chat. I'm going to take a minute to address. One of them, I think we actually just spoke to a bit about our panelists. Are they available for one-on-one support and therapy or counseling? So in terms of services, and Adam, I'll drop your information for Colmac Clinic in the chat again. Do any of our panelists just want to address? I know, each of you comes from a different background and field. Anybody want to address like whether you specifically are open to seeing patients or how somebody might get directed to one of your practices?
Sure. I am always an advocate for community health and individuals within the community. You could feel free to contact me. The name of my practice is Chakra Moon Inc. It's Chakra, CHAKRA, Moon, all one word, like the moon in the sky, Inc., INC.com. You can reach me at 410-340-0189. I do request that if you do reach out, to just say that you had been a part of the Howard County Health Department webinar, and just so that I know where you're coming from and I can field you getting in very quickly, and I would be honored to serve. So looking forward to hearing from anyone.
Great, thanks. And we'll share some additional resources here at the end, and with the archive recording and an email that everyone will receive afterwards, there will be some additional connections, and we'll include some of those resources, Stephanie, that you mentioned. We can pull into that. So there was another question. Let me just pull up my toggling between screens here. About the, would you say that mindfulness is the same as being intentional in the moment or self-aware of what is going on in the mind, body, soul? Maybe
That's a great
Stephanie?
question. So being intentional in the moment absolutely encompasses mindfulness and vice versa. There are, as I stated, many different terms for mindfulness that are often out in society at the time. But for me, it's about connecting in with the present moment and also connecting into your wisdom so that you understand as you face the storms in life that the strength within you remains stable and it's connecting in with that in a grounded way.
Lovely. And one more question here or comment really maybe from someone. We went through some great examples during the discussion today. Someone has asked if you could please provide an example of a breathing technique or an acupressure point that you could utilize while in the office or during your normal course of the day.
So I feel one technique that's really helpful is just diaphragmatic breathing and then adding counts to that. So, and again, you want to do something that's comfortable and just as a kind of building off what other people have said, like Stephanie, mindfulness and breathing are both muscles, if you want to think about that way. If you're going to start a mindfulness practice, you want to go to the gym and start lifting 60, 70, 80 pounds or bench pressing your body weight. It takes time to work up to that, right? So mindfulness practices that start small, like breathing practices, you want to do something that is comfortable. If it's not comfortable to your body, then honor that. But that breathing practice of breathing in and out from your belly, and then adding counts to that. So like a 4 count in, a hold for 4 count out for 6. And that's something that can be done, I think, in the office is really just paying attention to your breath. Some other things that are really interesting is checking if you're grinding your teeth or if your jaw is locked, and if your tongue is at the top of your mouth. If you can lower it, it's so interesting how the body, if we pay attention to different parts of the body, how immediate the stress reduction effect can be. So those are all just little things that can be done. There is an emotional freedom tapping technique that involves the hand only. So like if you're out at the grocery store, you don't want to be tapping all the points on your body because that can look a little strange. There is a tapping technique with your hand. And if you want to find an emotional freedom technique provider, Psychology Today is a great way to start looking through for therapists or other people who might be able to provide that service.
Thanks, Adam. That was great. And it's actually a natural segue because we did want to try to squeeze this in before the hour closes out. And model some things you could do. So before we just close out, we're gonna maybe Kirsten, if you can move, to our reflection. Stephanie, we're gonna turn it over to you for a minute, just to practice a moment of that before we send you off with some closing remarks. Before we promise we'll get you out of here by 1 o'clock, 12:59. But I'm gonna let Stephanie give us a real in the moment example of how we can all start on this journey together.
All right, thanks, Colleen. All right, everyone. So we're just going to do a very brief meditation. So please sit up nice and tall in your seat. And you can either keep your eyes in a soft, gentle gaze in front of you or close them. Just noticing where your body is connected with the chair. Beginning to notice your breathing. So the great thing is that the mindfulness practice doesn't ask you to change anything. It simply asks you to show up just as you are. So checking in with yourself here. How am I? Noticing the quality of your breath. Perhaps noticing if the breath is smooth or choppy, shallow or deep. And if you find that your mind has wandered off to your thoughts, it's okay. Simply notice the thought without judgment. And then return back to your breath. Noticing the expansion of the inhale and the grounded quality of the exhale. And just tracing 2 more cycles of breathing. And slowly opening your eyes. Thank you for your practice.
Thank you, Stephanie. That was beautiful. Thanks.
You're so welcome.
Wonderful. As we close out today, hopefully that sends everyone off and you're not having to rush into something else. Adam, I loved your tongue trick about moving your tongue when noticing in your mouth. I'm guilty of that one. Just that simple movement in your mouth is a huge win. So thank you for our panelists today for your passion and your energy and your expertise in this space. I'm really excited to see where this conversation goes. I think many more minds have opened to holistic approaches and taking care of the mind, the body, and the soul together as one unit. And having this conversation today is something that we are really excited to have been able to host and have you a part of. Thank you to our audience for joining us. I'm going to put a little plug in here we have one more event coming up in April, and you'll see some information on this final slide. We do want to just make sure we send you off with some information. The Headspace raffle that I kind of plugged in the chat. Kirsten, if you could move to that final slide, please. We are going to be sending out a survey with some information about just feedback anonymous from today's content, and we would welcome you all to participate. You will get an email with that link. And we do have a few subscriptions courtesy of Aetna, thank you, to a 6-month free app subscription to Headspace, a mindfulness and wellness app. So we encourage you to complete that and enter that survey raffle for us. If you'd like to get that, you can pop your information there. If you'd like to revisit today's conversation or share it with others or check in along the way to keep you going on your journey, we are going to be sharing that link with you. This will be archived along with our other recordings at the Local Health Improvement Coalition website. So please stay tuned for that. Any final remarks from anyone before we send ourselves on our way on the St. Patrick's Day Wednesday? Great.
Thank you so much for having us.
Thank you for being a part of it. Wonderful information here to share. Thank you, everyone. Please be well, stay well, and go take care of yourselves and each other, okay?
Thank you so much. Take good care.
Thank you, everyone. It's been a pleasure.
Take care.